Target was to be at 30% vaccination at June 2022. So what we committed to during this mission is to support the country, and the country itself, its leadership has said we will resume the drive towards reaching that first milestone of 30% on the way to international targets by September of this year. So as partners, we are putting our weight behind that to move forward. I represent the partnership called the COVID-19 Vaccine Delivery Partnership, made up of UNICEF, WHO, the Gavi Alliance, the World Bank, and other partners that are here to provide support to countries to accelerate vaccination against COVID-19. We provide financial resources, we can provide technical assistance, and we help mobilize political advocacy and energy behind the effort of COVID-19 vaccination.
For the other countries that are doing better than us, what are they doing right that we're not doing right? What could we learn from them?
So I think in all countries, including Malawi, there's a number of factors that contribute to moving forward with COVID-19 vaccination. First of all is political leadership. Starting with the example set by the high-level leadership, the president getting vaccinated, as was done in Malawi, working with religious leaders to get the message out that being vaccinated, taking care of your own health is an important responsibility, both for you, but also to protect others. But really also working at local level. The importance of local leadership is so key. District commissioners, traditional leaders, other community leaders are critical in the exercise, and we need to work on mobilizing at different levels. That's number one. Number two, we need to have the vaccine delivered close to the individual. People often speak about vaccine hesitancy, and it's a real issue. There's been a lot of misinformation in the social media. So we need to address the issue of vaccine hesitancy and get the right messages out there. And the media, like yourselves, are key in that result, in that respect. But also using and working through social media in order to address that, and working with young people to get the right message out there. So that's one issue. But it is also true that Omicron has changed risk perception. We were lucky that it was a wave of COVID-19. It was a variant of COVID-19 that was transmissible but not virulent. And so a lot of people said, okay, maybe it's not as serious as I thought. And that's why it's important to get the vaccine to people's doorstep. So having the logistics mean of going door to door, decentralize the effort, really make it accessible as a vaccine to individuals. And a big and third plank of success is a dialogue around the reality that COVID-19 continues to be with us. It continues to be a very serious pandemic. In the last 4 weeks alone, we've had 14.8 million new cases of COVID-19, over 44,000 deaths around the world, adding to the 6.3 million deaths that have occurred because of COVID-19. It is a real and present danger, and we need to sustain the momentum against COVID-19, especially if you're one of the high priority or high risk groups. The elderly, those above the age of 60, the people living with comorbidities, so people who are having high blood pressure or diabetes or who have HIV, and healthcare workers and other frontline workers, bus drivers, other people who are all the time interacting with people and at risk of catching COVID-19. Getting vaccinated protects you from serious disease. It protects you from death due to COVID. It protects your family if you're living with elderly parents. And it reduces transmissibility. So it avoids the risk that or reduces the risk, it can't avoid it, but it reduces the risk that the next variant, which could be transmissible and virulent, affects you negatively. Being vaccinated is again the best protection against the effects of that next variant. And we don't know what's going to happen. We don't know what's going to happen in the future. So it is important to take advantage of this opportunity.
Talking about opportunities, there's an opportunity to accelerate vaccine delivery in countries like Malawi, where the uptake has been quite slow. And I know that as the COVID-19 Vaccine Delivery Partnership, you are driven towards achieving this. What am I going to see different in the next few, let's say, weeks or months to sense that indeed there is a drive to increase the uptake of vaccines? Because as a Malawian living in Malawi, I wouldn't say I've seen much of that push or drive in the past few weeks or months.
So I think firstly, what we have now is enough vaccines to get those that need it vaccinated, which wasn't the case until the end of 2021. Secondly, there's a commitment between now and September to have each month a period of 7 to 10 days interspersed with some of these other high priorities that I spoke about. The reality is we're dealing with cholera in the country, we're dealing with polio, so we need to sequence things. But there's a commitment to have every month a period of 7 to 10 days where there's going to be a concerted effort to get people out into communities to vaccinate those that need it against COVID-19. I've seen some of the best practices I've seen globally here in Malawi. There's something called the Vaccine Express, which is a truck that has music on it that gathers the community. It's quite entertaining. And in the process of gathering the community, there's a dialogue about COVID-19 and how to get vaccinated and other health priorities. And you can reach people through that mechanism. I've seen the health surveillance agents go door to door, house to house. They need to be supported to do that. And so that will be part of this 7 to 10 day period. And we've also seen motorcycles being repaired and put back into service to reach hard-to-reach areas. One health surveillance agent on a motorcycle with vaccines in the back of the motorcycle and a cold box going to a far-reaching area, and again, door-to-door, reaching those that need to be reached. In conjunction with that burst, that campaign that happens 7 to 10 days for each of the months between now and September, what will be important is to have more public discussion through risk communication and community engagement, to have the support of traditional leaders and religious leaders, and to have them be vocal about this opportunity to protect ourselves, to protect our families. So I think you'll be seeing that, and that this will yield a further momentum in the campaign and in the movement towards COVID-19 vaccination. Eventually we all want to go beyond campaigns. We want this to be part of the health services that are available to Malawians on an ongoing basis through the primary healthcare system. But no country has gone through a period where they've reached higher levels of COVID-19 vaccine coverage without a period of vaccine campaigns. Because when countries wanted the vaccine last year, they were not available.
Yes.
And we do need to catch up. So this is a commitment that I think has been made by the country. And from the partners' point of view, we are committed to making the resources and the technical support available to accompany the process.
Do the reports coming out of Malawi about COVID fund mismanagement worry you? There have been 2 audit reports that revealed that there was gross mismanagement of COVID funds, and I'm sure that the partnership looks at pumping in even more funds as we're getting to the next drive. Does it worry you that some funds were mismanaged?
Let me say that we work through a range of partners that have strong accountability messages and mechanism in place. As I said, the COVID-19 Vaccine Delivery Partnership is made up of a number of agencies, UNICEF, WHO, Gavi, the World Bank. And at local level, we are represented, and our most direct emanation is UNICEF and the World Health Organization. Those organizations have robust accountability mechanism. They have an approach to cash transfer which has checks and balances. There's audits, spot checks, and good cooperation from the health and other authorities to be able to work through all those systems. In addition, in a number of cases, there is a form of direct payment where all of the procurement, for example, gets done directly by the agencies, again, at the request of the authorities and working with the authorities. So we are confident that the resources that will be devoted to this exercise will be used properly. And the checks and balances are there to get the best assurance that that will be the case. Let me also say that this is not the time to step back. This is the time to double down on moving forward with COVID-19 vaccination in order that we get the protection that the population needs, especially among the high priority or risk group that I spoke of. Because there's so much else to do. And because this is an opportunity that we can't miss. We do not want the next variant to come to be, transmissible and virulent, and we didn't protect those that we could protect. But even today, COVID-19, as we speak, is causing disease and causing death. So, the responsibility that we have is to move forward with the right level of accountability, but to move forward without a doubt.
We're going to take a quick break from our exclusive interview with Mr. Ted Shaiban. He is the Global Lead Coordinator for the COVID-19 Vaccine Delivery Partnership. We'll be right back. Welcome back. If you're just joining us, welcome. Today we're talking to Mr. Ted Shaiban. He is the Global Lead Coordinator for the COVID-19 Vaccine Delivery Partnership, a partnership of several organizations and institutions that are trying to accelerate the vaccine delivery in many countries in the world, but particularly in countries like Malawi, which seems to be still struggling to vaccinate the majority of its population. And talking about the majority of figures that we've been having about the death toll that came through because of COVID-19 doesn't seem to match with what is on the ground, because it looks like in some cases the figures were misrepresented, and in some cases there was cases of underreporting of the death toll. Actually, the WHO says the actual death toll from COVID-19 might have been 3 times higher than the reported figures. Does that dent or does it increase the skepticism that there is about this disease here in Africa?
Look, I think there's a couple of points. The recorded death toll is 6.3 million globally as a result of COVID-19.
Yes.
Some estimates with WHO and the Lancet and other health authorities have estimated that the actual death toll may be 3 times that. Including, as a result of indirect impact of COVID-19. What's important as well to state is that COVID-19 has affected different countries differently when it comes to, say, the age distribution of the population, the rural-urban construct of society. But there is no doubt that it's been a serious disease that has had profound consequences on people's health, on excess mortality, and frankly has disrupted the world economy in a way that's been unprecedented.
Absolutely.
And we now have a tool, a vaccine, to protect ourselves against all those consequences. When you see societies that have opened up, that no longer wear masks, that are completely going back to an economic scale of life that wasn't there during the pandemic. They've done that because they've been able to vaccinate their population at high levels. And so it's important us to avail ourselves of the tool that we have and do our best to vaccinate the population against COVID-19. We should also say that we don't know the true extent of what COVID-19 has done in many parts of Africa because testing has been low. Again, we didn't have all the tools at our disposal at all the right places at the right time when we needed them. And as a result, we don't have the full picture of what occurred. And now, as other priorities have come on board, all over the world, testing levels are no longer what they were before. So we are operating with incomplete information. When you have the incomplete information, the best thing to do is to go to what is certain. And what is certain is that if you're vaccinated, you are protected against the worst form of the disease. You have a better chance not to, have the worst consequences or death as a result of COVID-19. And you're also protected against the next variant.
And now you listen to the messages being sent around. The message is more like we should learn to live with it. And at a time when you were hoping maybe we should be going towards eradicating the disease, and now it looks like is this a resignation to the fate that we have, or it's just a presentation of the reality on the ground that we must just learn to live with the COVID-19?
So COVID-19 is still with us. Some of what's being said, and it depends on where you are in the world and what's been done, is that we are in some ways over the acute phase of the disease. We've learned, or we've needed to learn, how to manage to live with COVID-19 in our midst. That's what societies are doing. We can't underestimate how tired people are, the economic impact that has happened on the world. And so to an extent, it is the case that we need to live with COVID. But what does that mean? That means, again, getting vaccinated when you have the opportunity. When you're seeing surges in waves, as we're seeing in certain parts of the world, whether it's South Africa or parts of the Northern Hemisphere, adopting preventive measures, including going back to wearing masks for a period while that wave is there. And again, doing the right health-seeking behavior, the right hygiene-seeking behavior. Those are the tools that we have at our disposal right now to address, indeed, the reality that COVID-19 is in our midst, and that we need to continue to manage it.
And I know it may be a bit difficult to come up with an exact figure, but do we have a figure in monetary terms in terms of how much the COVID vaccine delivery partnership has contributed or has supported to Malawi since it started?
So the partners that we make up and we are pulling together and pooling those capacities have contributed to date for COVID-19 vaccination $6 million, with the government contributing another $2 million. So there's been $8 million contributing altogether to date. In addition, there's $4.2 million under negotiation. This is an amount that's being contributed by Gavi. And what we said as a partnership during this mission is, working also with the broader set of partners who have contributed greatly to the country, USAID, the US government, the German government, the World Bank, the EU, the Canadians, and other partners. What we have said is, as a group of partners, we can make sure that the resources are available to continue this momentum on COVID-19 vaccination. The country team, led by the Ministry of Health and its partners, is putting together, an updated budget which takes into account these campaigns that are needed, these vaccination campaigns that are needed, and whatever the gap is, and we have an idea of an order of magnitude, we will work together to cover that gap. Resources are not going to be the constraint of this effort. There is a commitment to work with the country to give the best chance to Malawians to be vaccinated.
Aside Malawians getting vaccinated, many aspects of life were affected. The economy, the social side of life, and education. Schools were closed for very, very long periods. And now the Malawi government is trying to come up with the social economic recovery plan, where they're trying to see how do we help our students get back to school and catch up, and that in case something like this hits again, it doesn't hit this as hard as it did. Do you intend to support that drive as well, the recovery drive?
So the COVID-19 Vaccine Delivery Partnership itself does not work on issues related to education.
Okay.
I'm, from the point of view of my own career, for a long time UNICEF staff member and firm believer in the critical importance of education. And so let me perhaps leave with two messages.
Okay.
Number one, it's critically important to keep schools open under all circumstances. And I think one of the most difficult aspects of the COVID-19 pandemic has been the closure of schools and the impact that this had on children. Not just the impact on their learning, but on their mental health.
Yes.
I think we all have seen our children struggle in terms of even staying in contact with their friends and the social issues that they had to deal with. The second point I would make is that the best way to support schools staying open is to vaccinate against COVID-19 and to adopt primary healthcare measures, and specifically to consider teachers as frontline workers, because they're in contact with a lot of people. So we encourage teachers to get vaccinated. In Malawi, COVID-19 vaccines are available for anyone 12 years and above, so that is also an option for students in that age range. And again, the more teachers are vaccinated, the more people are vaccinated, the safer we are, the better it is in terms of keeping schools open, which is critical to children, their learning and their well-being.
As we're winding up, any last message, especially to those who don't want to get vaccinated? Because I know this has divided opinion in terms of whether I should get the jab or not, and religious and social factors coming into the mix. But still, we're talking about lives here, and we do all agree that we have to do whatever we can to save lives. But still, there are those who are resisting getting the vaccine. What would be your message to them?
My first message is, around the world, billions of vaccine have been administered. 60% of the world's population has been vaccinated. This is a safe vaccine. I myself have had 3 doses of the COVID-19 vaccine. And the whole point of getting vaccinated is to get and protect yourself against future disease. And so please go out there, get vaccinated if you're not vaccinated already. If you've had your first dose and it's a 2-dose vaccine, get your second dose. If you've had the 2 basic doses, get your booster. If it's time and you're one of the categories where it's legitimately your time to get a booster. Because the more you are protected, the less risk you have of serious disease or death, and the more you protect people around you. This is not just about you, it's also about your contribution to your family and to society. This is the key message that I would deliver. And I want to deliver a second message, which is I want to thank all those frontline workers, those health surveillance agents and the others who day to day are out there fighting for COVID-19 vaccination, fighting against COVID-19, against polio, and against cholera. They are our heroes, and I think we owe them to work with them and to use the tools that they have at our disposal to protect ourselves and to protect them.
Mr. Ted Shaiban, Global Lead Coordinator for COVID-19 Vaccine Delivery Partnership. I would have shaken your hand, but since we're in COVID-19 times, I won't. But let me thank you for giving us time to talk to you.
Thank you.
Thank you so much.
Thank you.
And that's the end of our exclusive interview with Mr. Ted Shaiban today. Until next time, from me, Joe from Chakaza, it's goodbye.
My name is Teresa Temwekandanga, chairperson for the Media Institute of Southern Africa, MISA, Malawi. The world is going through a challenging period with the outbreak of coronavirus. At times such as this, it is very easy to believe any information that comes our way or share out any information that we come across. But this is also the particular time that we need to be very careful with the information that we share with others. Only share information that is coming from a credible source and has been verified. At this particular time, you don't want to share out information that